Hello, my name is Clarissa Lovaki, and today I will be presenting on the body system of cognition in the older adult. The Webster Dictionary defines cognition as the process of acquiring knowledge and understanding through thoughts, experiences, and senses. Basically, it's what you do with the information that you perceive and feel. Now, there are many changes that occur in cognition in the older adult. One of these include an increase in crystallized intelligence. Now, what that means is the skills, abilities, and knowledge that you learn over time and that you practice over time. So this includes things like vocabulary and the skill of driving. Now, clearly, the longer you live and use these skills, the better you get at them. So there's an increase in crystallized intelligence. At the same time, there is a decrease in fluid intelligence. Now, fluid intelligence refers to the ability to problem solve, to reason, and to think on your feet in a situation that you're not familiar with. This would be decreased in an older adult. They also might have lower selective attention, meaning that they'd have a harder time focusing on one specific stimuli and blocking out the irrelevant stimuli. For example, it might be harder for an older person to focus on one person that's talking to them in a crowded room because they'd have a harder time blocking out the other noise. The older person might also have a difficulty with divided attention, meaning they wouldn't be able to multitask or focus on multiple different things at the same time. This becomes very hard for the older adults. There's also a slower cognitive processing and motor response, so it just takes longer for them to respond to things. And they also may have memory impairments. One would be a delayed free recall. Another would be source memory, so it'd be harder for them to remember where they learned a specific piece of information or a skill. And they may also have difficulty with prospective memory, which refers to the ability to remember to perform a task in the future, like watering your plants or picking up the kids from school. Now, there are many different types of ways to assess cognition. I'm going to talk about two today. One of this is called the Mini Mental State Exam. Now, this is a 30-item exam that you can take. It's for anybody. You can do it to yourself. You can give it to a person that you know, like an older adult or a neighbor, to assess orientation, attention, short-term memory, language, calculation abilities, and things of that nature. Now, the MMSE test is for anybody to use, whereas the clock drawing test is more used by professionals, and they use it to assess different stages of cognitive disease, like Alzheimer's and dementia. Now, the test is just what it sounds like. They're told to draw a clock and to put the minute and hour hand right where they belong, and this is used to assess number fluency, vision, hearing, and dexterity. Now, some assessment findings that you could gather with the mini mental state exam is a slower processing time and a shorter attention span. They might also have an inability to retain new information. And like I said earlier, the clock drawing test is to assess the severity of a cognitive disease. And so you might find that the patient is drawing asymmetrical numbers, or they're missing numbers, or they're repeating numbers. They might even draw numbers outside of the clock. Any of these things you can use to assess stages of dementia and Alzheimer's in a patient. Now, I would like to talk about different diseases that may occur in older adults with cognition. There's three that I will talk about today. One is dementia, Alzheimer's, and Parkinson's disease. So dementia is more of a general term used to describe various neurocognitive disorders like Alzheimer's and delirium. It is a slow and steady mental decline, and it is progressive. Now, some of the symptoms include memory loss, impaired communication, impaired focus, and attention span. And so basically, dementia is a term that refers to a decline in mental ability to the point that it interferes with your daily life. Now, There's also a thing called Alzheimer's disease, and this risk for getting this disease increases highly after the age of 80. And this occurs because brain cells die, and that's because the synapses that communicate between neurons also die, causing the brain cells to die. And one of the first signs that a person has Alzheimer's is unable to retain new information. Now, this manifests itself in different ways, like forgetting to brush your teeth or forgetting the person that you have just met. But as the symptoms get worse, they might also experience severe memory loss, anomia, which refers to the inability to think of the word that you want to say. They might also have changes in judgment and behavior, and this is one of the diseases that is slow and progressive, and comes to a point where you might not even remember your own family members, which is very difficult. Now, there's also Parkinson's disease, which is a slow and progressive neurodegenerative disorder. And this happens because of a destruction in the cells that produce dopamine. And dopamine is a neurotransmitter that helps control movement in the body. So as you can see, this would cause many problems in the patient. Some of these problems include a resting tremor, which can be seen in patients. One of the tremors they might have is called pill rolling, where they take their fingers and roll them as if they're rolling a pill between their fingers. They might also have muscular rigidity, which leads to a person having this type of Parkinsonian gait, which looks like a person who is taking very small steps and kind of has their head crouched down because the muscles are so rigid. A Parkinson's patient might also experience bradykinesia, which refers to being slow in all of your movements. And also, Parkinson's has an asymmetrical onset, meaning that it might get worse faster on the right side than on the left. It's not going to be symmetrical most of the time. And those are 3 common diseases that occur in cognition as a patient gets older. Now, there are ways that we can prevent or slow this process, and that's where education comes in. Now, these points of education look like things you would say to any patient, but they're as important, if not more important, for the geriatric patient to improve mental function to prevent diseases. Now, there was a study done in Finland that it included 1,260 patients, and there were 2 groups that were split up. And one of the groups had a combination of all these points included into their lives, and the other group did not. So the first group included a healthy diet, regular exercise, socializing, challenging their brain, and modifying vascular risks. This included a nutritionalist being able to have control over their diet. They were all required to go to a fitness class that was taught by a physical therapist, and they did things to challenge their brain, like taking a cooking class or doing things that they'd never got to do, which of course made them socialize, and they also encouraged the modification of vascular risk like obesity and cigarette smoking. And the reason why they touched on this topic of vascular risk is because a lot of times neurological disorders occur due to cardiovascular disease or a stroke or an MI. And so these things can be prevented by taking care of your heart and of the blood vessels that you have. And so all of these things were taken into account and utilized in the first group, whereas the second group didn't have these resources. All they had was a class about how to be healthy and tips on how to maintain good mental health. Now, at the very beginning of the test, both groups took a mental exam. And also at the end of the test, they took the same mental exam, and it was found that the patients in the first group had a 150% higher processing speed and response time than the second group, who didn't have all these resources and didn't engage in this kind of lifestyle. And it was also found that 83% higher executive function was found in the patients that were in the first group that had all of these options, whereas the second group did not have as high of executive function. This article is basically saying it is important to combine all of these, not just one of these, but all of these things into your lifestyle to maintain high mental acuity. Now, this is very important for a geriatric patient, and it is important for nurses to educate them on this kind of behavior. These are my references, and thank you for listening.